Hello, and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, we are joined by Dr. Erin King-Mullins, who is currently a practicing colorectal surgeon in Atlanta, Georgia. She received her undergraduate degree from Xavier University of Louisiana, her medical
Thanks
degree from
you.
from Emory University in Atlanta, her residency training at Orlando Regional Medical Center in Florida, and completed her fellowship training at Georgia Colon and Rectal Surgical Associates, which is a mouthful. Um,
Yes.
she has recently become a new mom during the pandemic, and Dr. King created Corona Mamas, a safe space to discuss issues as they relate to the new reality of maternal health, COVID-19, and racism. So, welcome. Thank you for joining us today.
Thank you so much for having me today, Dr. Fleming.
So, how are things finding you today? How are things in Georgia? How is work, family, negotiating all these new times?
Every day is new. Every day is different. I think that's one of the things that this whole pandemic has taught us all is to how to be able to pivot, at a moment's notice. But one of the things I guess that's kind of new for us this week is we just put my 6-month-old in childcare, and so that was a whole that was a whole nother mental process that I had to go through with that. But everybody's managing pretty well.
Fair enough. And I want to spend a little bit of time just so people kind of know your background a little bit on why you chose medicine, why you chose colorectal surgery specifically, because that is a unique field, and relatively, not relatively, increasingly important and in focus right now within light of recent events. And then I'd like to spend a little bit more time talking about the Corona Mamas platform, because I think that is also very unique and born out of innovation in this changing time. So just tell us a little bit
Sure.
about your journey here, and then we'll transition.
Okay. Well, I knew from a pretty young age, I'd say roughly around 12, that I wanted to be a doctor. My sister, who's actually 11 years older than me, went into medical school, and I'm trying to figure out chicken and egg. I just feel like I've always wanted to be a doctor, but definitely her going to medical school kind of helped that be able to become a reality for me. And so, just went on that journey, went on that process, and when I actually graduated from medical school and was going into general surgery, when I first started residency, I entered thinking that I was going to do trauma surgery. Loved the excitement. Went to a pretty heavy trauma center down there in Orlando. And about 6 months in, was like, this is not for me, just the lifestyle and everything. And so thought I was just going to do general surgery. I really, entering residency, didn't even know that colorectal surgery was a specialty. And then through the course of having to do the various rotations, I experienced colorectal surgery a few different times and just saw the gamut of what it had to offer patients, from the office setting, inpatient, outpatient, treating patients for cancer, and, even doing little things. I think it was just a great mix of everything. And, you can help someone a few times and that's it, or you can establish really long lasting relationships with patients, just depending on what they came to see you for. And so that's what really got me into colorectal. It's just the sheer vast array of treatments. And one of the things I tell people all the time when they come to see me is that, just because you're seeing a surgeon doesn't mean you need surgery. And so there are actually a lot of people that I help, with just kind of training them on how to take care of themselves and avoiding surgery. And they actually sometimes are very relieved with that, because they come very timid and shy, and they come with this mindset that they have to have surgery, and they're terrified. And so when I talk them through things and they find out they may not need surgery, they're sometimes just forever grateful for that. So that's how I got here.
I like it. I relate to you on the kind of that busybody nature of medicine. So, and that's one of the
Mhm.
reasons I chose OBGYN. I like being able to go to the office, go to the OR, go to, labor and delivery. So it keeps us busy.
Mhm.
Um,
Mhm.
and I think one of the biggest gifts I could ever give people is like, well, I don't have to do a pelvic exam today. And they're like, you don't, it's like, we don't
Yeah.
always have to do something to sometimes we can just talk
Yeah.
about it.
Mhm. Mhm.
And so it was the beginning of this year. You added a new addition to the family.
Did.
And yeah, and as I should say congratulations. Um,
Thank you.
Going through that experience as a Black woman, as a physician, and then having one of these health disparities that we talk about frequently. Can you share with us a little bit about that experience and then how that led to the need for Corona Mamas?
Sure. So I delivered mid-February, and one of the things that it was a long delivery process. It was nothing that I expected it was going to be. I went in for my induction, and so we were like, "Yeah, we're going for induction on this day. We'll be out in a couple of days. 3 days in the hospital, maybe 4 days max, and you go home." And so, my process, my induction did not progress well. Then we battled with some decelerations or decrease, of the baby's heart rate associated with contractions, and it got severe enough to where I ended up with, an urgent C-section, and then that was kind of, fine. After that, it was just kind of, whew, sigh of relief. All right, let's just do our regular recovery and be able to go home. I didn't really have much complication at all during the pregnancy. I had battled a little bit with fibroids, but nothing that put the health of the baby, or the delivery at risk. So I thought, and then I had some of the orthopedic stuff, like I had carpal tunnel, which made doing colonoscopies difficult. But by and large, I had a benign pregnancy. So the day before or the evening before I was scheduled to be discharged, my blood pressure started going up, and I wasn't experiencing any ill effects or anything like that. And they said, "Oh, we'll watch it." And then progressively through the night, they're making sure I'm getting rid of visitors. I'm just hanging out, relaxing, even send the baby to the nursery for a little bit just so I can get some relaxation. And all of a sudden, my blood pressure is like through the roof. So they're stat rushing me to another unit and putting me on drips and all that stuff. So my total hospitalization for my pregnancy was 8 days. And that was, obviously not expected at all. And so in the aftermath of that, being diagnosed with postpartum preeclampsia, started to do a little bit more research and things, because now I'm at home taking blood pressure medicines, having to, titrate them and adjust them based on my blood pressure, which I've never done before. And so, all of this stress kind of leads to some anxiety and just some fears, and you're worried about breastfeeding and how that's affecting that, and, not being able to breastfeed as well. And sometimes you have to just, when your blood pressure is 180 and you're just chilling, you kind of gotta go and just say, "Hey, here's the baby, let me go take a nap," or something like that. And so just all of that stuff going on led me to do some research. And, I just saw that Black women are, much more likely to be affected by, preeclampsia, and, much more likely to die compared to their white counterparts. So that kind of led me down one road. But then the pandemic hit. And so about 3 weeks after delivery, we're shelter in place, everything shut down, nobody can come back to visit. So, we're completely isolated. And so that adds a little bit more anxiety and a little bit more stress. And I'm looking online to kind of find a resource that I can use, as being a professional mom. So somewhat, so being in medicine, even though not OBGYN, I just had a little bit of trouble finding the source that I wanted. Then fast forward, you got the social unrest going on with some of the racism. So, racism is another public health crisis. So all of those things, me and all of those feelings and trying to process that, that's how I came up with Corona Mamas. So.
And that's it is a perfect storm of a lot of things this summer, spring and summer. And we had been talking, I think, in the general kind of media more about Black maternal health recently.
Mm-hmm.
and beginning more publicity. But preeclampsia is definitely one of those things that it's hard. It's unpredictable.
Mm-hmm.
And when we talk about the adverse outcomes in Black women, I mean, we won't go into all the statistics, but they are
Right.
stark, right? It's like it
Yeah.
can't be this different, but it is. And to speak to, it's unpredictable through the medical course, but it's also unpredictable by risk factors, right? So you
Right.
would look at you as an individual thinking, you know, we're still young, we're young,
Mm-hmm.
healthy, right? And had a benign, like you said, uncomplicated pregnancy for the most part, but yet these things still happen, and trying to figure out
Mm-hmm.
how to best address those is something clearly we're still struggling with. Um,
Right.
and then and then adding on these other complications of the civil unrest and the pandemic is just it's definitely a perfect storm, if you will. Um, Tell us a little bit more, kind of putting those things together. So we're in this um, uh, COVID-19 situation where a lot of the disparities and inequities have been highlighted and lifted up, right?
Mm-hmm.
And being a colorectal surgeon in the aftermath of the abrupt death of Chadwick Boseman, um, I'm sure you have been getting pulled on, called on to respond. So, this is a different health disparity, um,
Right.
but one that is very, um, I think, again, when we talk about maternal health disparity, we're talking about young people, right? And we're noticing younger and younger cases of colon cancer, right, in young people. So
Right.
we're talking about our contemporaries, and so I think that as an individual is even more scary.
Mm-hmm.
So tell us a little bit about the academic conversations that you've been having at work, and then what do you think are the best, interventions and outreach as we go forward?
Sure. So, the disparity in colorectal cancer has something that we had been really bringing to the forefront and trying to focus on with our National Colorectal Society. We actually formed a diversity and inclusion task force this year to address some of the disparities in um, uh, academia and in medicine with regard to minorities, underrepresented minorities going into the specialty, but also to address the disparities in screening and access to care and treatment for African Americans. And so we as a society and some of the other societies had actually been advocating for quite some time for African Americans to start colorectal cancer screening at 45 as opposed to the general age of 50. 2 years ago, the American Cancer Society actually came out and made a statement recommending that the colon cancer screening for everyone should be 45. The rest of the healthcare world has not quite caught up to that yet, and so it's not necessarily always easy to get those patients screened. Sometimes it's a little bit of a struggle, but I think one of the things, just I think overall, that the unfortunate untimely passing of Chadwick Boseman has brought attention to colorectal cancer in general, and then also the disparities with colorectal access, screening and access to care, and understanding that we now have to not just assume because someone's young that their symptoms are not related to cancer. Now, I'm not speaking specifically about Mr. Boseman when I say that, because we don't know his whole situation. We don't know if this was something that was an inherited issue, as far as if there was any type of cancers that ran in the family, if there was a genetic issue at all. We don't know if he was having symptoms and had a delayed presentation. We just don't know that at all. But I think just seeing that he passed at 43, they said he had been battling with it for 4 years, meaning he had been diagnosed late 38, early 39. That just really has put this to the forefront. And so we are working on collaborative efforts with multiple organizations to put our heads together to figure out what do we need to do? How do we better address this? And so we're working on education efforts to get the word out to not only the community, but also to some of the physicians and insurance companies that may be the gatekeepers to have that access for these patients.
Yeah, I am. I'm interested to follow along, and hopefully, I think when anything happens that is this abrupt and heartbreaking, for lack of a better word, that we don't let this opportunity for education go in vain, and hopefully it will be um, a pathway to us getting more access to screening and education around screening and what that means, and hopefully we won't
Yeah.
lose more people's
And one of the
access.
biggest things, and sorry, but one of the biggest things I think this also brings to light is sometimes patients, families, friends may find these things embarrassing to talk about those types of
Mhm.
things, and so it just makes it that much more important to understand that we do need to talk about those things, because especially in families, what you're going through directly impacts your loved ones, especially your first degree relatives. And so having those conversations, so if for example, you may have a symptom and go to a doctor and they may say, oh, you're 35, the likelihood is low. But if they know that you have family history of these problems, then they may be more in tune to say, we should just do a colonoscopy to 100% certain. So it takes both personal responsibility, but also policy changes, and those have to come together so we can really make a difference.
Definitely, definitely. Well, before I let you go, because I don't want to keep you too long, I think another thing that you brought up early in the conversation that is important is as you overlap as a physician and a mom, and we are talking about childcare and going back to
Mm-hmm.
school, going back to daycare, going back to whatever, but negotiating that space as a mom
Yeah.
who can't stay at home with her kids, right? Yeah, that doesn't, your
Mm-hmm.
professional life doesn't allow that. But I know that's a challenging conversation of how to do it safely. So,
Right.
in a few minutes, can you kind of talk to us about your thought process and reassuring other moms who, are having to make these tough choices? There's not really a right answer, right? It's just the best answer
Right.
for your current situation. But
Exactly. So we have a little bit of a unique situation. I do have three stepdaughters that are in middle school. So they recently resumed school, but their district is doing the distance learning. And so we're balancing that. We have them a week on and a week off. At a time. And so and then my husband's working from home right now, and so we were lucky and fortunate to be able to keep her home for 6 months, but as schedules are becoming more rigorous, we do need more assistance with that. And so we were back and forth between doing the nanny thing versus doing outside of the home child care. And one of the things with the aspect of the nanny, with just everything being so busy at the house, it would have been just very difficult to have three middle schoolers, an adult working from home, and then introducing someone else to the home to care for an infant. That was just a little bit too busy, but was willing to do it if that was the only solution. But we were fortunate that our my hospital actually has a child care facility, and so they have access to all the PPE, and are very rigorous with the management. And one of the things that actually made me say, okay, it's okay if she goes, is because she's an infant, so she's not really running around and touching other kids. And so that was just kind of one of the things that made me feel a little bit better about the situation. But again, as far as I know, from what I've done, because I've read lots of articles and things like that, I've followed different public health professionals. Even there's a pediatrician, I'm blanking on her name right now, but she does a lot of public health work in the pediatric world in New York. And she wrote an article about the safety of children going back to the classroom as long as the appropriate measures are being taken. And so you just got to do your research and know what's good and appropriate for your family. And if you have particularly high risk family members at home, then that may not be the option for you. So that's just kind of how we handled it.
yeah. Well, thanks for sharing. And like I said, I know there are a lot of moms who are continuing, or it's not just moms, but
Right.
families that are continuing to
Mm-hmm.
struggle with this. And so it's always nice to kind of understand what, how you made your decision and if it could be helpful
Yeah,
to anybody else. So thank you for sharing.
definitely wasn't easy. Definitely wasn't easy, but we'll see how it goes. We got well, Monday was Labor Day, so we got 3 days down.
Well, as we wrap up, I usually like to end on an upbeat note, which not that we're on a down note, but
Right.
what what are you optimistic about? What are you looking forward, kind of as we hopefully transition out of the pandemic and or post COVID-19 days? What are you looking forward to?
I'm just looking for, a little bit more kindness and sensitivity, folks who are going through this. It just kind of forces you to take a little bit of a pause and try to realize, what's important. Life has slowed down quite a bit, with having the kids. We used to have to run here, run there, run there. So our schedule's busy, the kids busy. So it just has allowed things to kind of slow down. You really appreciate each other, the time you have. And I think understanding in this pandemic that what you do directly impacts your neighbor and so on, I think it just helps us practice a little bit more mindfulness and maybe just be a little bit more kind.
I like it. I like it. And where can people find you online and social media?
So for me personally, on Twitter, I'm eking719. That's at eking719. But if you want to know more about Corona Mamas, our website is corona-mamas.com. And we're also on Twitter at Corona Mama 1. That's the number 1.
Perfect. And I'll put that in the listening notes for our listeners. But
Awesome.
thank you so much. I appreciate you joining us today. I wish you well in all your busy life and schedules and being pulled in all different directions. But it sounds like you're doing great work, and we appreciate all the work that you're doing.
Well, thank you. Thanks for having me. And I hope we can chat again.
Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.